Thank you, Madam Chair. I just want to, if I could, to Mr. Steele and Mr. Kelly and Mr. Violante, I want to talk about the Alaska Heroes Card. I want to describe it because sometimes there's and I've read your testimony in detail, and your concerns are equal treatment, fairness, reimbursements. Let me describe Alaska for a second. First off, I was just there on Memorial Day in Quig, Alaska, which to get to it, you have to fly from Anchorage to Bethel. Then you have to fly from Bethel to Quig in a four-seater plane, if they have one available and the weather is good. There's no road. That total trip took 2.5 hours of travel time, air time. In our state, we have the premier Indian Health Services in the country. Why? Be frank with you, Indian Health Services doesn't run it. We run it. It's the Tribal Consortium. Our tribal communities in Alaska took control of the Indian Health Services because they want to deliver health care the right way. So we have veterans in Quig. In order to get to Anchorage, to the VA center, it's $2,000 air transportation. Who pays for that? The Veterans Administration. Yet there's a clinic right across the street, or road, because there are no streets, trail, that's run by the Indian Health Services, but our tribal consortium, providing incredible health care. In Nome, Alaska, we are building a $170 million state-of-the-art Indian Health Services care facility. But again, if a veteran is there, they will not be able to use that facility. They will have to get in a plane, because they cannot drive, because there are no roads, with 80% of our communities. There is no state like this. As I read your testimony, I know you want to try to keep everything. There's no state like this. There's no state that you can drive to another clinic, but yet there is a high-quality run facility right there. And what we're trying to do here, and if you read this, I understand your commentary and how you've written some of your testimony. The key part is roadless communities in Alaska. That is pretty narrow. We have more and more, you know this, more and more veterans living in rural communities in this country. But I can tell you right now, in Alaska, with 77,000 veterans, the highest per capita of any state, we have a high percentage in rural Alaska. We want to provide them the best care. And we believe this piece of legislation will actually lower the cost of the VA. I mean, when an individual has to fly to Anchorage and then sometimes to Seattle, because we have no VA hospital. Let me make sure we're clear on that too. We don't have a hospital. We have a clinic and some CBOCs, that's it. So when they have to get the service, they got to fly thousands and thousands of dollars and away from their families, which, as you know, a veteran for care is critical to be close to their families, be able to have access. So I want to work with you folks, and your concerns are easy to be met by, I think, clarification. But I want your response to, it's hard to understand Alaska until you've been to one of these small villages and you meet a veteran who told me and the secretary of the VA, in order to get his care, the fly alone was $2,000. Well, that means someone down here in Lower 48 is going to not have $2,000 worth of care, because that's going for an airline ticket. It doesn't seem right. And so can you give me some comments? I've given you, it's a statement, but I want your comments so you understand where we're coming from. And it's not Montana, it's not Utah, it's not North Carolina, it's not Washington. It's very different. Give me any one of you three that want to comment.
Senator, I'm not an expert on VA healthcare. I have staff that focus on that. But I do think your question should be directed to VA. I mean, they have the authority to provide fee-based care.
I'm going to interrupt you for a second. We did that for years. It didn't work. That's the problem. And the reality is we have a fully federally funded Indian Health Services sitting right there, run by a tribal consortium, delivering equal, or in some cases, be very frank with you, higher quality than what can be achieved in the VA system at times in Alaska. So I understand that question, but but you've opposed, or you've had questions on mine, so I'm asking you, how do we get to your concerns?
I mean, that's our concerns, is VA has the authority. They can provide community care or contract care when necessary, and I don't understand, and maybe they've explained it to you, why they would want to spend $2,000 to fly a veteran somewhere when they could go to a clinic, you know, nearby. I mean, to me, that doesn't make sense, and I'd like to know VA's answer to that, because with the authority they have, they should be able to take care of those veterans, and if they're not, then maybe what should be happening is some oversight by this committee, getting VA in here to find out why they're not doing that. I mean, I just had my deputy went to our department convention in West Virginia, and a veteran came up to her and said that he's been on fee basis for years. He has a service-connected disability rated higher than 50%. And they told him they didn't have funds to continue to do that. Now, this is the same VA that this year said they have a $1.1 billion carryover and would like to split it up between 2012 and 2013. Things aren't making sense, and our concern is VA needs to be doing what they should be doing, and I agree with Senator Burr that we need to be looking at ways for them to do it better. I just am not comfortable with your bill and what it means to other veterans also around the country who may not be in such severe situations, but still in need of health care when VA has the authority to take care of most of this.
I believe Joe stated it very articulately. I don't believe I have a whole lot to add. It's my understanding, though, that VA and Indian Affairs is working to try to figure out a single pay method. I'd like to understand that a little bit better and where that's going, and if that would be an effective alternative to a veteran's card that would allow them to use Indian Affairs.
Madam Chair, I know we're over time, but if I can just make one quick comment. They have an MOU, and it's basically driven by our efforts here, because this kind of crystallizes, because the one thing we don't want to do with veterans is to have to constantly worry about how to get service. You know, we had testimony here 3 weeks ago, 4 weeks ago, with individuals talking to us how they literally pass facilities to go to those fee-based because of some arrangement they had. In Alaska, you don't get to drive by those fees. There are no fee-based. There's no other doctor. It's Indian Health Services, and every single village in Alaska has a clinic. There's no place like it, and it's because we have to deliver health care in a very different way. So that's why they're doing the MOU, is because they know something like this is necessary, or at least they're aware that we have to figure this problem out, because the current fee-based system doesn't work in Alaska because of the way the system is. It's a federal government facility and another federal government facility. It's not a private doctor sitting out there getting the service. It's a different situation, and that's why it's draft. I'm going to work with you folks, because every time I go to a veterans organization in Alaska, when I mention this, and we go to a lot of speeches, senators, and we get applause at the end, this issue, when I bring it up, the way I just described to you, it's not just an applause, it's a standing ovation, because Alaskan veterans understand this is the care and how they can access it, because they have tried the other ways and it doesn't work. So I just want to have you have an open mind. Hopefully I've described Alaska a little. I'd love to take you to Quig and drive on that road that's really a boardwalk and fly into that airport that's a dirt road and a pad. But that's what we're trying to accomplish here. So I'll work with you folks, but I understand your global picture. But I really think this has for Alaska, it is so critical that these veterans get the care that's sitting, 50 feet away from them, but they can't touch it. I'll leave it at that.
Thank you very much, Senator Begich.